bring you this. Phase 2 of the vaccination rollout kicked off on Monday. Pfizer vaccines were administered to those over 60 years and healthcare workers, including those living with comorbidities. Government says it hopes to wrap up this phase by the end of June. Now, public health medicine specialist at the Colleges of Medicine of South Africa, Dr. Karen Begg, joins me to discuss how the rollout is currently faring and if we have the capacity to reach the stated vaccination goals. Doc, thank you for your time and a very warm good morning to you. That is the question on everyone's lips. How is the vaccination program currently faring at this point?
Thank you very much and good morning to everybody. And I think we were all a little disappointed at the beginning of the year with the few hiccups that we've had around the AstraZeneca notification that it wasn't as effective to the variant that we've picked up in South Africa. And then waiting for sufficient doses for Johnson & Johnson and then being able to roll that out under the eNCA protocol. We have done 500,000 healthcare workers to date. But obviously the second hiccup with the slight pause in the Johnson & Johnson rollout was also due to the concerns about side effects for clotting. But, you know, we're well on track, and I think that government is doing a good job under the circumstances. We obviously would like it to be a lot faster than it is. And I think that yesterday was a good trial run. Everything went particularly well. I think as we start to ramp up, we have these two competing issues of sufficient sites, sufficient vaccines to be able to administer the vaccinations, and then on the other side, vaccine hesitancy and people not coming forward to either register or be vaccinated.
Yeah, and with that being said, I mean, I think there are concerns about whether or not, you know, the Department of Health does have capacity to sort of conduct and perform parallel vaccination programs, because, I mean, unfortunately, phase 1 is still very much behind. The minister said there were approximately 1.25 million South Africans they had targeted, at least healthcare workers, to have vaccinated in phase 1, but we are just above 500,000. With that being said, Doc, I mean, do you think we should be concerned that the government may not have capacity to run parallel programs, or do they have?
So I think that it's a little bit of uncharted territory, but certainly being involved in some of the planning behind the scenes, or having been asked to assist in some of the planning behind the scenes, I think that the plans are certainly very robust, and there are a range of additional healthcare workers being appointed, as well as volunteers. As universities, we've been asked to assist with the provision of our senior students to act as vaccinators, which we are doing, and a range of other healthcare workers are coming forward to engage in vaccination. So I think that we have the capacity. I just think that the challenge will be the numbers in time, and of course we're fighting the imminent third wave coming up as well. So you've got to balance this, you know, crowds queuing for vaccinations with not wanting crowds and the possible infection of COVID. So there are lots of challenges facing government at the moment, but certainly the planning right now is robust and coherent. And, you know, the decisions around, we have sufficient vaccinations, because that was one of the challenges. So right now, you know, there's sufficient. We obviously need to make sure we don't waste any, because that would be an awful tragedy. But we also need at the same time to be working at vaccine hesitancy and overcoming that.
Absolutely. Yesterday, quite interestingly, when my colleagues were on the ground across the country, speaking to some of the senior citizens about, you know, their, you know, preparedness, or whether or not they're looking forward to getting the vaccine or not, it seemed the issue around the, you know, electronic data system was an issue for the elderly, Doc, especially when it comes to, you know, some of our elderly citizens not even having a smartphone or not knowing how to be tech savvy and make use of it. It seems that might also be part of the reason why we've been seeing those low numbers of registration. What could be done to ensure that those issues are resolved so we could see a very more faster pace in registrations, particularly in phase 2?
So I think that's really important. I mean, I think this is the first time that we will have a single health data system in the country. So it's quite exciting for us from that perspective. But as you say, being electronic and digital does mean that it has limitations in terms of access. However, the Health Department have just released a range of other mechanisms. So one is through the SMS system, another has a toll-free line that you can call and somebody will assist you, a call center will assist you to get registered. And then there are massive campaigns, including libraries and others where people can come into those spaces and be facilitated. So a range of other civic society agencies are being asked to assist in getting people registered. So I think that there is a campaign around not only relying on people being able to access the internet and registering on the EBDS.
All right, we'll leave it there due to time, but thank you so much for talking to me. That's Dr. Karen Beg, of course, talking about the current vaccination program and the capacity that which the department has to fast-track this process.